Numerous studies have shown a correlation between childhood traumas and a later diagnosis of cancer. So, if you have cancer or know someone that has cancer and you haven't included treating emotional traumas as part of your treatment plan, you need to start now. Today, I'm going to share with you a test called the ACEs and how we can use this to improve your health. I'm Dr. Jake. I'm a naturopathic medical doctor and integrative physician. On this channel, I share with you how you can heal your body down to the root causes without any drugs or surgery. Be sure to subscribe for more videos like this one.
You're watching the Dr. Jake podcast.
Okay, let's jump in. I'm here today to review the connection between emotional trauma and cancer. So there was a test that came out called the ACEs score, Adverse Childhood Effects Score, in which has shown a correlation between cancer and childhood traumas. So there's several questions that are asked, and then you're given a certain score. And if you have a high score, 6 or higher, you're going to have a much greater risk of getting cancer than someone that has like a 1 score or 2 score, for example. So this opens up a lot of things, very interesting to me. This isn't something I really looked at in great detail. Okay, let's look at your childhood traumas and see if that could be a reason why you have cancer. So this was really an eye-opening test to me. And also when I started reading the research, it was really eye-opening to be like, hey, I know that stress is a big piece of cancer because I've seen this all the time. And I talk to my patients about this, that we need to decrease our stress. We need to work on our emotional state, anxiety, depression, our self-esteem, our anger, and etc. But maybe a big piece of how they deal with the world is based on the traumas that they had as a child. So I'm going to dive into that a lot more. And it's really interesting. So what was the correlation between the longitudinal studies that they've done to actually see, okay, these people had childhood traumas and now they have cancer? What they saw is they did this comparative analysis. They did this ACEs score, and they saw that they had a high number of 6 or more. And they saw that people that did have this, they had a 2-fold increase of getting cancer, which is huge. It can be somewhat discouraging for a lot of people because a lot of people had the childhood traumas, but I think it's good to know that maybe you need to look back and think about what you have been dealing with, and maybe a lot of how you deal with the world, maybe based on the traumas that you experienced as a child, and you need to make changes in that regard. So I think I'm going to read through these questions and really dive into what these questions entail. I'm sure a lot of you listeners are wondering, oh, what are the questions? So I'm just going to read them, make a few comments maybe on the questions there. And if you've experienced any of these questions that I'm going to ask, I would like you guys to leave a comment in the comments and tell us if you've experienced any of these. So number 1, did a parent or other adult in the household often or very often swear at you, insult you, put you down, or humiliate you, or act in a way that made you afraid that you might be physically hurt? Number 2, did a parent or other adult in the household often or very often push, grab, slap, or throw something at you, or ever hit you so hard that you had marks or were injured? So as we see on these top 2 questions, it's looking at abuse, right? Either physical or psychological abuse. And that's a big piece of emotional trauma that is involved in this ACEs score. Did an adult or person at least 5 years or older than you ever touch or fondle you, or have you touched their body part in a sexual way, or attempt or actually have oral, anal, or vaginal intercourse with you? Did you often or very often feel that no one in your family loved you or thought you were important or special, or your family didn't look out for each other, feel close to each other, or support each other? So that's a very interesting question there. It's looking at your mental state, your emotional well-being, of how you felt about yourself or other family members when you were growing up, and how that can affect you for your entire life. Did you often or very often feel that you didn't have enough to eat, had to wear dirty clothes, or had no one to protect you, or your parents were too drunk or high to take care of you, take you to the doctor if you needed it? Were your parents ever separated or divorced? Was your mother or stepmother often or very often pushed, grabbed, slapped, or had something thrown at her? Or sometimes often or very often kicked, bitten, hit with a fist, or hit with something hard, or ever repeatedly hit over at least a few minutes, or threatened with a gun or knife? So this is very interesting, that it's not necessarily what just happened to you. It's actually just what's happening to a family member in your life, either to your father or mother, in either being physically abused or emotionally abused, but also just the trauma that you dealt with your parents getting a divorce. Did you live with anyone who was a problem drinker or alcoholic who used strength drugs? Was a household member depressed or mentally ill, or did a household member attempt suicide? Did a household member go to prison? So, very interesting. I'm sure a lot of you listening to this have dealt with this. These are very common things that children deal with growing up. But what's really interesting, if you do have several of these, your risks of chronic illness go up. So it's not something to be like way scared about it. Oh crap, I've dealt with this. Now I'm just going to be a cancer. What, I can't do anything about it. There is a lot that you can actually do it of actually recognizing that how you deal with the world is based on maybe some of these childhood traumas, and how you deal with your stressors. You need to think about that and think about how you deal with those situations, and that can improve your future life greatly. As an integrative physician, I think of emotional state greatly in my practice. And I have seen it with the 10 years of my practice, how much your emotions affect your health and well-being. I've seen this with cancer. I've seen with this autoimmune disease. I see this with chronic fatigue syndromes, migraines, and your emotional state, but also how you feel about yourself, how you deal with your stressors. So I talk to my patients about this a lot, and it's interesting to actually be thinking about childhood traumas now and how this is actually affecting how these parents, as these adults, are dealing with the world. Very likely, the way they deal with the stressors or how they deal with their emotions was based on how they were reared or how they grew up and the situations they dealt with up to 18 years old. And now they're still dealing with those things when they're older. So yeah, I definitely have seen a huge correlation with emotions. Most patients that come into me, I would say at least 90% have dealt with a strong stressor, either a divorce or a lot of work trauma, or a sibling or parent passed away, or whatever, a severe stressor that was 2 weeks or longer. And then they came up with the diagnosis of cancer. So I've seen this happen all the time. And I bet you a lot of these patients have dealt with emotional trauma when they were younger too. So it's something that I'm going to be tracking a lot more in my practice and asking a lot more questions about from reading these studies. Like I just read a study that I included 100 studies on this topic. So there's a lot of studies on this and how much childhood traumas can lead to chronic disease. And that's all I do. I treat mostly 95% of my patients are chronic illness patients. So a big piece of my practice is going to switch and actually asking these questions about this ACEs score to really help my patients deal with their emotional traumas so they could actually get to the next level. I bet you a lot of my patients that haven't gotten all the way better, I just didn't deal with this piece. So it's very enlightening to me. So me as an integrative physician, I am not a psychologist per se. I do have training in psychology and how to deal with that. And that is a piece of what I do in my practice. But I do refer out. But here's the thing about psychologists and psychiatrists is I don't refer to specific individuals very often because everyone is different. Everyone deals with the psychologist differently. So usually what I say is a piece of your treatment plan needs to be that you deal with these traumas. And many times you need to go to a psychologist, not a psychiatrist. Psychiatrists usually are the ones that prescribe drugs. Psychologists are really going to listen to you and change your viewpoint and change the way you think about things. So I do that quite often and say, hey, we need to get a psychologist on board because I don't think you're going to get all the way there and getting better without doing that, when I recognize that a big piece of their issue is related to their emotional traumas. So what are some of the things I do on the psychology background? So when I see my patient, I'm not spending all my time talking about their emotional state, but I do ask them about their emotions, what they're dealing with, the traumas that they have dealt with in their lives, what type of stressors you're dealing with. And then I try to guide them shortly on the right path of thinking about their emotions differently, listen to them and try to guide them to think about that emotion in a different way. Many people have a certain trigger when they hear something. And then I try to change that trigger that they had so they don't have the stress response whenever they hear a certain situation comes up where they hear a certain thing of how to deal with it in a different way. But I only spend a short time with that. And I see that it's a big piece. that's when I refer out that there's going to be a lot more time that needs to be spent. Sometimes only the few little short times I talk to them and actually bring up ways they could change the thinking is enough. But in certain situations, it's not. Yeah, visit our website, integrativemedica.com. Find our phone number there. Give my receptionist a call. You can set up an appointment with me or some of my other awesome doctors that we have. You could also just set it up on our page there. You could click on the setup online and set up an appointment that way. If you want to learn more how to prevent cancer with an integrative approach, click my videos to the right. I'm Dr. Jake, and I'll see you there.